Hello, I hope you're all well. Welcome back to this nutrition module of Trying to Conceive After Loss. And I really hope that you've been enjoying the course so far. Now, I'd like to talk to you for a few minutes now about the murky world of supplements, because it really is a fertility minefield. There are so many opinions out there, and very often clients come to me rattling with supplements, things that they might have read on a blog or in a magazine or in a book, or things that have been recommended by a well-meaning friend. But the thing that we've got to bear in mind, and I know that this sounds really, really obvious, but we are all unique. We're all beautiful snowflakes, if you like. And just because something's going to work well for one person does not mean it's going to work well for somebody else. We've also got to bear in mind that there's an awful lot of dodgy science out there. And so we have to be really, really careful about those things that we know are really, really going to be not only helpful, but also safe. And with that in mind, what I've done is I've put together a list of those things that really would be safe for anybody who is considering trying to conceive. So I've taken it back to a kind of foundational level, if you like. Anything over and above that is going to be very specific and tailored to the individual. But these are the things that, to be honest, almost anybody are going to be it's going to be okay for them to take. So first of all, when we're thinking supplementation, we've got to get one thing really clear, and that is that however much you might like to try, you can't out-supplement a bad diet. Supplements can certainly enhance a good diet, but if your diet is bad, you're never going to be able to make that catch up necessarily. Okay. Now, one of the reasons for this is that most nutrients work better together rather than in isolation. So it's got to be food first. And I really would refer you to the diet section of this module so that you've got, again, those broad foundations, and you've got a really nice approach to eating generally meal by meal, which is going to get you in a really, really good position. Now, thinking about this idea that nutrients work better together rather than in isolation, it's worth bearing this in mind when we're thinking about those supplements, and in particular thinking about a multivitamin, because we know now, and we've got really good evidence to support this, that taking a prenatal or a pregnancy or fertility multivitamin has been shown to improve pregnancy rates in women compared to those women who take folic acid alone. And this is the case for both natural and assisted reproduction techniques. Okay, so we're looking at both natural and IVF here. So there was one study, for example, which I've quoted here, which saw 66.7% success rate with those women taking a multivitamin, compared with only 39.9% for women taking folic acid. And this was after 3 Clomid-supported cycles. So this is something to bear in mind. You don't want to be taking folic acid alone. You want to be taking a prenatal. And when we're thinking about the prenatal, there are some things that we really want it to include. So it's got to have folate in it. Now, folate is actually the naturally occurring form of folic acid that we would find in green leafy vegetables, in pulses and things like lentils. Folic acid, on the other hand, is the synthetic form. Now, the reason that we want folate is because quite a large proportion of the population have difficulty converting folic acid to folate. So if we start with folate, then we're going to be giving our body a little bit of a helping hand. We also want B vitamins in there. We want vitamins C and E. We want zinc, selenium, and choline. Those are, if you like, the broad basics. Now, a word on choline in particular, because it's a relative new kid on the fertility block. We've only recently, in the last 10 years or so, begun to understand just quite how influential and important it is from a fertility perspective. And actually, it works alongside folate to support DNA synthesis and also to reduce the risk of neural tube developments. So this is one that we really do want to include, and it's worth bearing in mind. Have a look at your multi, and if you're not, or if it doesn't include choline, then you might need to be taking supplementation elsewhere. We also want vitamin D. Now, certainly in the UK, but in most countries that aren't sunny throughout the year, we need to consider vitamin D supplementation. In the UK, we can only actually make vitamin D from the sun between the months of March and September. And even then, we've got to be even more specific, because between March and September, we can only actually make vitamin D between the hours of 11 and 3. And this is because these are the times of day when the sun's rays directly hit the Earth's surface at the right angle for our body to be able to generate that vitamin D. Now, we can get it from other sources, from eggs, oily fish, for example, but not in the sort of quantities that we need. So vitamin D supplementation, certainly in those winter months, is an absolute must. And this is actually even supported now by government guidelines. We also want to be thinking about omega-3. Now, I mentioned omega-3 in the diet section of this module. Omega-3s are beneficial, or one of our beneficial anti-inflammatory fats. We need our bodies to be able to support our immune system. We need to make sure that we are not getting into an inflammatory state, because that can cause problems for us. But also, omega-3s are really important for the cellular health of each and every one of our cell membranes. And what we want is those cell membranes to be nice and supple. If they're supple, it's a lot easier for those cells to be able to communicate with each other and with our hormones. So if we have a nice amount of omega-3 in our diet, so again, we've got oily fish, we've got eggs again, we've got nuts and seeds, but you need to be having quite a lot. So I do think it's worthwhile actually taking omega-3 in a supplement form as well. Then again, you're going to be putting yourself in a much better position. Now, I don't know about you, but when I have talked about supplements to, for example, my mother in the past, she's always said, well, we didn't used to take supplements and we were absolutely fine. Now, that might be the case, but what we've got to bear in mind is that our soils are far more depleted than they ever have been before. And similarly, modern lifestyles are fueled by things like caffeine, alcohol, stress, lack of sleep. So these supplements can really give us a helping hand. So they are absolutely something that we want to be considering. And when we are thinking about them, we do need to think about quality rather than quantity. I recommend generally that we don't get our supplements from either high street supermarkets or high street pharmacies. This is because generally, and there are exceptions to every rule, you're going to be getting the lower value supplements that very often contain things like, for example, fillers. They might have less good absorption rates. They may not have been so well formulated. Instead, try to seek out supplements from an independent health food shop. Or I've also given you a special discount code, which you can use for professional grade supplements from a company called The Natural Dispensary. So again, you can have a look at that, and that will help you in terms of choosing the right supplements for you. Now, what we also need to bear in mind is that nutrients have effects on other nutrients. Nutrients also have effects on certain medications. So again, what we want to do is be safe here. If you have been prescribed any medications at all, I really recommend you running your prenatal and your fertility supplements past your GP or your consultant. To give you an example, omega-3 oils, which I've just said how important they are, they can actually interact with, for example, baby aspirin or heparin or Clexane, because they all perform the same kind of blood thinning properties. In many cases, it's absolutely fine to take those omega-3s alongside, but I do recommend you double checking with the person who prescribed your meds. I mentioned before that I've given you a discount code, and one of the things that accompanies this course is a short supplement guide that I've put together for you, which just goes into a little bit more detail about some of these really, really important nutrients that you should be searching out. And also a little bit more detail again, for example, if you are vegetarian or vegan, or if, for example, you're over 35 and egg quality is something that you're particularly concerned about. So have a look at that supplement guide. I really, really hope that it helps. And good luck.